Unfortunately, reoccurrences and metastasis do occur. And I think it's really, really important for anyone in that circumstance to be able to appreciate and value what's important for them. It becomes a very, very simple decision-making process. And I try to help patients understand that whatever they're dealing with, it very really boils down to, does this increase the quality of my life or does it detract from it? And by that, I find that a lot of patients in that disease trajectory will spend a lot of time worrying about others and expending a lot of energy to help others, to take care of others, to help others avoid the significance of their disease. And that's not fair. I mean, that is a lot of expended energy that could be put to better use. You know, so when that patient is in stage 4 with metastases, it's about what's important to your life. What makes you special? What gives you the best quality of life? And how can we help you to achieve that? And what are the physical limitations you have? How can we overcome them? How can we help to increase the quality of your life? I frequently will help patients understand that when you get to stage 4, it becomes a chronic illness. We're performing holding actions. And every day should be important. If you're expending energy worrying about other people, expending energy taking care of or trying to avoid other people, that's energy you could be putting forth other places to improve the quality of your life. Whether that means taking a vacation, going to Hawaii, spending time in the garden with family, going and seeing grandchildren. What is important? What makes you unique? And what type of message do you want others to be taking away from this time? Unfortunately, once the doctor has said the C word, from then on, every bump, every bruise, every cough, every cold, the first thought is always going to be, oh my God, it's back. And I often liken that to the analogy of a drug dealer. You know, how does a drug dealer hook his clients? The first one is free, but after that, you have to pay. So to acknowledge the fact that there's always going to be that first thought that says, oh my God, and just to acknowledge it and say, this is a normal process. But to entertain that thought afterwards is when you have to pay. And you have to pay with anxiety, you pay with decreased immune system functioning, you pay for fears, worries, upset, lack of sleep. So it's best to just acknowledge and say, you know what, this is a normal thing. I'm always going to have this. I don't have to give it power. But then again, the flip side of that is I always want them to be vigilant. You know, I don't want them to ignore things. So in that way, that first thought is actually a good thing, because I ask my patients to scan their bodies. Are they feeling different? Because I'm a firm believer that patients really do know their bodies, and they know when something's different. So if you have that first thought and something genuinely feels different, then maybe it's something you should contact your physician about. And what if is always going to be there? What if it comes back? What if I miss it? What if I've passed it on to my children? You know, and what can you do about these things? You know, and that's where that cognitive behavioral therapy comes in, is helping patients understand and confront those thoughts and say, well, what do I know? Well, I do know I'm fairly healthy. My last lab tests showed X, Y, and Z. I have a good medical team. I'm taking the best care possible. And that I also know my head is out to get me. You know? So you can have yes, you can confront those thoughts and you can deal accordingly. This is the basis of cognitive behavioral therapy, which is the mainstay of treatment in our field. It helps deal with anxiety, depression, It's the gold standard of treatment. It's how do our thoughts influence our feelings, which impact our behavior.